Hi, and welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Today on the show, we have Greg Jasani. He's an emergency medicine resident, and he wrote a couple of Kevin MD articles. Please don't make physicians choose, and do patients addicted to drugs truly have capacity? Greg, welcome to the show.
Hey, thanks for having me. It's my pleasure.
So we'll get into your articles in a bit, but first
Yep.
off, can you share your story and your journey to where you are today?
Yeah, absolutely. I was born and raised in Delaware. I'm the child of two physicians. My dad's an emergency medicine doc, and my mom's a pediatric emergency medicine doc. So I guess you could say it came naturally to me to go into emergency medicine. I was fortunate enough to go to college at Georgetown University. I was a government major and a theology minor. Always knew I wanted to be a doctor, though, so I took some pre-med classes in there. Went straight through to George Washington for my med school, and now I'm at the University of Maryland completing my emergency medicine residency. I'm a third year, so almost done. So looking forward to going out there and being a real doctor.
So you are clearly proverbially on the front lines of the pandemic. So how's the pandemic affecting you and what you're seeing every day?
Yeah, I mean, it's definitely changed. And if you had told me when I was, going through my education that within 2 years of graduating medical school, I'd be on the front lines of one of the worst pandemics that not just this country, but this world has ever seen, I would have said, no way. But here we are, we're definitely seeing more and more patients who are critically ill. Keep in mind, in the emergency department, we don't always have the luxury of knowing whether someone has coronavirus or not. So we have to assume that everyone does, which means for just about every patient that we see, we're gowning up in full PPE, N95, surgical mask, face shield, gown, two sets of gloves. And that can be exhausting. One, you just sweat like heck and all that stuff. But two, it kind of disrupts your flow too. Before this, I wouldn't think twice about just going quickly back into a patient's room to ask them a follow-up question or to get something. But now I really have to think, is it worth me putting back on everything just to go into this patient's room and, ask maybe one or two clarifying questions or to grab something that I might have left in there. And that's probably been the biggest adjustment for me, is just the amount of thought I have to put into even the simple things that involve going into a patient's room.
Sure. Now, what's something that you've learned over the last few months that you wish you knew back before the pandemic started?
A lot of things. I wish people knew just kind of what we go through. And I wish that I had a better way to convey that to people. I've certainly enjoyed writing on your blog, and I think that's certainly a big way about getting our message out there. I wish there was just more that I could do to kind of show people, hey, because I don't think a lot of people know what those of us in healthcare are going through right now. And I just wish, and I clearly still don't have the answer as I'm saying this. I wish though I knew of a better way to kind of get what we're seeing out into the general public.
Sure. Now let's talk about one of your Kevin MD articles. Please don't make physicians choose. Now, for those who
Yeah,
haven't read your article, can you walk my audience through it and share the story of why you decided to write it?
absolutely. So I wrote this, I think back in March or April, I don't quite remember, but it was right around the time when cases were starting to rise for the first time, and there were genuine discussions of whether we as a healthcare system would have enough resources for all of our critically ill patients. And every time I turned on the news or turned on the radio, there was some pundit talking about, well, are we going to have enough ventilators? And, what's going to happen when we have more patients than ventilators? And that just got me thinking, who's going to be the person who's going to have to make that decision of who gets a ventilator and who doesn't? That's going to be us physicians. And for all the guidance that agencies like the CDC have put out, they hadn't put out anything of how do you make those decisions. And my gosh, what a terrible position to be in, what a terrible choice to have to make. But it was something that at the time I genuinely wondered if we were going to be put in that position. And that piece was my way of kind of expressing those fears and those trepidations, and begging someone else, either be it some government agency or what have you, to put out some sort of guidelines to kind of guide us in those decisions. Thankfully, it never got to that point at my institution, at least. Hasn't gotten there yet. Hopefully it never will. But that piece was kind of my fears of where this pandemic might lead us.
We are certainly still in the first wave of the pandemic. Some would say we're in the second wave,
Yeah.
but it's certainly not going to abate anytime soon.
No.
So, is it always in the back of your mind when it comes to potential shortages, whether it's ventilators or remdesivir or medications for
Mhm.
patients? Whenever you see patients who come in COVID positive.
Absolutely. And every time I intubate a patient for whatever reason, my first thought is, oh God, is there going to be an ICU bed for this patient? And yeah, I mean, and certainly as the cases go up, I'm watching my own state of Maryland where our cases are steadily climbing too. And like I said, we've been doing okay for now, but if the cases keep going up, at some point something's got to give. At some point, the upgoing curve of the patients who are critically ill is going to exceed our available healthcare resources. And keep in mind too, COVID-19 isn't the only thing that we deal with in the emergency department. We still have just as many strokes, heart attacks, asthma exacerbations, COPD exacerbations, what have you, as we did before. So not only do we have COVID, we still have everything else that we did before this. And our at least at our institution, our healthcare system was already operating at 90 plus capacity pretty much all the time. And, especially as we move into fall and this coincides with flu season, I do genuinely wonder how we're going to keep pace with the number of critically ill patients I anticipate we will get.
So when it does come to a point where we're running into shortages of medical supplies or medication or equipment, now what's the normal procedure? Are those decisions solely in the hands of the physician, or is there an independent counsel within the institution who makes those decisions on where to allocate scarce resources?
Honestly, I don't know. I would assume that the hospital would have to step in and say this is how we are going to allocate our resources. I would hope, because if they don't, it truly is going to be each and every one of us physicians, in the emergency departments and the ICUs making those calls. And I don't know how we do. It's certainly nothing that I don't think any of us had ever imagined we would a situation we ever imagined we would face. It's certainly nothing we've ever trained for. So I hope, like I said, I really hope that someone, and I imagine it would be the hospital, would step in and give us, fairly definitive criteria for how we do allocate those resources. What that looks like, I have no idea.
So let's shift gears and talk about a second Kevin MD article that you wrote. Do
Sure.
patients addicted to drugs truly have capacity? So again, for those who haven't read your article, can you walk my audience through it and share again the story of why you decided to write it?
Absolutely. Well, I think as you said, I'm in Baltimore. I practice in the inner city Baltimore, and drug addiction is a thing that I unfortunately see a lot of in my practice. And these patients come in a lot of times very critically ill due to some of the consequences of their addiction. But many of them will initially come in saying, I want treatment, I want to get better. And I genuinely think they believe that, but their addiction, unfortunately, a lot of times is stronger than their desire or their want to better themselves. And a lot of them end up leaving against medical advice before they can complete this treatment. And I see that pattern play out week after week, a lot of times with the same patients who will come in, sometimes, 2 or 3 times in as many days, with each time saying, I want to get better, and then leaving shortly after, because their addiction is too strong for them. And as it stands right now in this country, those patients have the ability to do that legally. They have what's called capacity, meaning they understand the risks and benefits of leaving before they can complete treatment. So I, as a physician, cannot stop them from doing so.
Mhm.
But in this piece, I wonder, are they truly making an informed decision, given that it's known that addiction changes the chemical compositions of your brain? It changes how you think. And it's something I've asked myself a lot as I'm, having these patients sign the AMA paperwork is, are they truly making an informed, rational decision, or is this the addiction speaking? And if they're not making a rational decision, should we allow them to make this decision, or should we do more to stop them and keep them here so that they can complete their treatment?
So what's the answer here? I think you wrote in your piece how other countries deal with similar situations.
Yeah, New Zealand, and the country I spoke about was New Zealand, and they do have laws that actually allow patients to be held involuntarily so that they can complete their medical treatment. And I think for them, there's some kind of drug detoxification and rehabilitation services thrown in there as well. I don't know how that would work in a country like ours where we do have individual freedoms granted to us, under the Constitution and a lot of other laws. I personally, because of the perspective I have on this issue and because of what I've seen, I would love to have laws like that. I think it would do a lot of good for a lot of my patients. Unfortunately, I don't know if there's the legal justification to do that.
So if you had a patient in front of you who you think does not have the capacity to sign out AMA, what are your options available to you?
Well, so for my patients who I don't think have capacity, a lot of times we have security at our hospital that can assist us in kind of redirecting them back to their room. If they truly try to leave, we have to do what's called chemical restraints, which are usually benzodiazepines. So we typically use Ativan and Haldol, which is an antipsychotic. We call it a 5 and 2. We give 5 milligrams Haldol to Ativan, usually IM, IV if they have it, but sometimes IM if they don't have anything, to kind of sedate them and keep them there. And hopefully in that time while they're sedated, we'll kind of fix whatever the underlying issue is that kind of brought them to our point and makes it so that they don't have capacity, so that when they come back to, either their head's more clear and they recognize the need for treatment and choose to stay, or again, their head's clear and they still want to leave, but at that point they would have the capacity to make that decision.
Sure. We're talking to Greg Jasani. He's an emergency medicine resident. He wrote 2 Kevin MD articles. The first, Please Don't Make Physicians Choose. The second, Do Patients Addicted to Drugs Truly Have Capacity? Greg, my last question. Do you have a take-home message that you want to share with the Kevin MD audience?
If I had to say one thing to your audience, I would say, don't be afraid to get out there and write. I read pieces on your blog for years and years before I finally worked up the courage to submit my own piece. I really enjoyed it. Typing things out and allowed me to get some things off my chest and give voice to a lot of things that I had felt privately for years. I found that to be hugely beneficial. And to everyone in your audience out there, you have a unique voice. You have something to offer to the conversation. Don't hesitate to put a pen to paper and send it in and get it out there for the rest of us to read and enjoy.
Greg, thank you so much for sharing your writing and insight, and thank you for being on the show.
Hey, thanks for having me. It was my pleasure.